Hello everyone, welcome to today's Instagram live session. My name is Ziba. I'm founder of Ametical Global Health Tourism Company. Today we will be discussing the most important topic for many families, IVF or in vitro fertilization. In order to understand this topic better, Dr. Sevinc Serdarli will answer our questions about IVF. Good afternoon, Dr. Sevinc. Thank you for joining. So today I'll be asking you the most common questions which I have received from people around the world about IVF. So let's start from first one. Why do people need IVF and at what age should they start considering it?
Yeah, like in gynecology, one of the point of our guidelines is that if the paid couples has a regular sexual relation during 1 year, like up to 35 years, but during like 6 months over 35 years, and they don't have any pregnancy, it means that these couples have some problem. Like this problem can be in male body or in female body or in both of them. And if this period, like in 1 year and after 35 years, 6 months, if this period is completed and we cannot get any pregnancy with natural way, this couple should be examined. And even we cannot find any like abnormal findings in this examination, these couples need any treatment. Like we have like two types of treatment in infertility. Like one of them is IUI, but the most successful our like treatment type is IVF. If like in this period, like as I said before, the patient doesn't have any pregnancy, they need IVF.
Okay. Thank you. So the second question, how can patients check the success rate of a hospital or doctor before choosing them for IVF?
Yeah, actually, it's one of our like recommendations for like patients in choosing the hospital and IVF doctor. Like it's like they can get information from hospital and also from doctor about the success rate of this IVF department. Like every IVF department has success rate. Like we get this information at the end of every month. And this success rate actually shows the quality of hospital, the quality of working of gynecologists and also embryologists, the quality and the conditions of embryology lab in operation room, like everything affects in the success rate. So the patient like is one of my recommendations for patients, get information from hospital and also from doctor about the success rate, how many patients they have and how many of them get pregnancy. Yeah, according to literature, like in the best like success rate of IVF is approximately like 55%. But in our department, in IVF department of Liv Bona Dea Hospital, the success rate is approximately 65%. So it's
great.
like over the average. So it's like one of the main points in IVF treatment.
Perfect. So next question, if a patient had an unsuccessful IVF treatment in another hospital or in another country, do they still have a chance of success at Liv Bona Dea Hospital?
Yeah, sure. Like actually, like most of our patients, like similar like this patient, like they had lots of like some serial attempts before, and they got like they couldn't get pregnancy, or they got pregnancy, but it's like ends with miscarriage, and then they was diagnosed. Like most of our patients like that. I have like few patients that I am trying the first time. So surely, if the patient and her and husband has cell like female cell and male cell, they have like every time they have chance. So if the previous ones were not like successful, it doesn't mean that the next one will not be. But in this part, for us, very, very important to have information about the previous attempts. Like we try to get like if the patient like can get this information from like private hospitals, it would be great, because we want to, like as gynecologists and also as like embryologists also work like that, we want to see what was the possible reason of this problem in the private sector. So why they they couldn't get pregnancy, because if I know the reason, I can change it in next time. So, and yeah, I can get success. So we have lots of patients like that, and my recommendation is like to give to give us more information from about previous like attempts. It's very
Good. So next question, when patient asks for the IVF price package, is it important to review their medical records first?
Yeah, actually, like
And why
it will be.
it is so necessary to review medical records?
Yeah, actually, yeah, it's because like in like routine IVF package, we have extra other like services too, like for example, PGT, pre-implantation genetic diagnosis, like genetic tests. Or we can use like donor cell, or like and genetic test has like two types. So if I know the like medical condition of the patient, I can advise, I can recommend something like extra this services, and also it will change the price. Sure.
Understood. So why is the IVF package with PGT tests and chromosome selection is more expensive than standard IVF package? This is the most asked question me.
Okay. First I want to explain how we do this genetic test, because like in normal IVF, yeah, we get a female cell, then a male cell, and embryologists create embryos from that and follow up the development of embryos during 5 days. It's the routine IVF, and then we transfer it to the cavity of the womb. But if the patient needs PGT and chromosome test, after like third day or fifth day of this embryo, embryologist gets a biopsy from the embryo, and we send it to genetic tests. And after that, we can get information about like health condition of this embryo and about the chromosome and genetic material of this embryo. Normally, like doing biopsy is additional procedure, and especially like genetic tests is also some costs. Surely, like the difference, the reason of the difference between these two packages is because of that, like genetic tests.
Understood. So there are many countries that offering very low IVF packages, but often with poor success rates. What specific questions should patient ask to evaluate a hospital's credibility and success rate?
Yeah, surely it's not only in other countries, also in Azerbaijan, like some like centers price is low, but it's like 2 points here is very important. Like some departments show the price low, but they don't include too much services in it. Like for example, like some departments don't include ultrasounds or blood tests or hormone tests or medicines. If we don't include it, surely the price will be low. But at the first point, the patient cannot understand what the difference. But after starting the treatment, like after some days, she will need to pay another extra charge. So at the end, actually, the total will be more than others.
Correct.
More than ours. It's the first point. So, like, patients should ask, what this package, what includes this package, which services are included in this package. This is the first point. But the second point is, yeah, like totally the price is low, but the success rate is low. So if the like package includes medicines and like gynecologists prescribe the low dose of medicine or the cheaper medicine, surely the stimulation of the eggs will be low, and the gynecologists could not get enough cells and with good quality. Or if embryologists will use like less liquids in lab and cheaper liquids, cheaper material, cheaper catheter, cheaper needle, surely the quality of embryo will be low. So this part is not visible for patient, but actually this all steps affect on success rate. That's why at the end the success rate is low.
Okay. So next question, can you share Liv Bona Dea IVF success statistic, including how many treatments have been successful and overall success rates?
Yeah, surely. As I said before, like our success rate is approximately like 65%, and it's over than average according to literature, gynecological like IVF literature. So it's like very, very good like result. And like every month we check the success rate. And like last, I can say about like last year, last special, last 6 months, it was not low at 65%.
Wow.
And so yeah, it's very, very good number. Like our like patients, surely like most of them are Azerbaijani, like approximately like 30 patients per month. But we have lots of foreign patients, so like approximately 10, 15 patients per month. We have, but we like our department is like really big, and we have like our staff amount, and also like the area of our department is very like suitable for more patients too. So we're planning to get more patients for next month, for next time,
Good.
for future. Yeah.
Perfect. So how many days do patient needs to stay in Baku for overall IVF process?
Yeah, like every patient, like it's like approximately like first question of every foreign patient.
Yeah.
Surely I can understand why. So in like when we start the medicines to increase the cells of female body, like these medicines last approximately 10 days. After that, we do egg retrieval. And after egg retrieval, we advise to stay in Azerbaijan approximately 2 days more. So it means that the first stage, approximately like 2 weeks, is okay for us. And then we can do fresh transfer, like when we get like embryo, we can transfer it. But most of all, we do frozen transfer, because when we compare fresh transfer and frozen transfer has more success rate. But if for the patient is very complicated to come here again, we can do fresh transfer. If we'll do fresh transfer, it means that this like approximately 2 weeks will be enough for us. But if we're planning for frozen transfer, the patient should come here twice. The first time for 2 weeks, and then she can leave Azerbaijan to go to her country. And in next cycle, for preparation of the womb, actually we need like 21 days preparation and the transfer. But this total time, she doesn't need to stay in Azerbaijan, so she can start her medicine in her country and then to come here. So like for second stage, like 2 weeks is also okay for me. But some patients say that like I can stay just 1 week. We can also plan like for 1 week. So totally like 2 weeks.
2 weeks.
First one, yeah, for both stages, 2 weeks or 1 week. Okay.
Great. What medical records should patients send before traveling to Azerbaijan for IVF treatment?
Yeah, we need like in second or third day of menstruation, ultrasound report, like transvaginal ultrasound report that especially shows the amount of eggs in ovarian masses and the temperature of the womb. It's very important for us. Anti-Mullerian hormones that shows ovarian reserve, like how many eggs she has, and also sperm test of husband, surely. Like this is like 3 tests are important for us.
Okay. So what's included in the IVF package at price in Liv Bona Dea Hospital?
So as I said before, our hospital like decided like to include all these old services in one package. like except this package, patient doesn't pay anything. So this package includes the medicines that we use in first stage to increase the eggs, and in second stage for preparation of the womb. So medicines, it includes medicines. All the first consultation with gynecologist, all ultrasound during this procedure, because like during this time we do approximately more than like 10 times ultrasound, all of them, and egg retrieval, like to get egg cells from the female body, and also it includes creating embryos, like like lab side of this procedure, creating embryos, following up, and it includes also like transfer this ready embryos to the cavity, and also it includes hormone tests, because during this procedure sometimes we need it, like blood tests for hormones, and also preparation tests, because these two procedures, egg pickup and also transfer, is done in operation room. That's why patient needs some blood tests and also consultation with anesthesiologist. Like this, all services are included in this package.
Perfect. At what age do women most commonly require donor egg?
So it doesn't depend only on the age. Surely the age is one of the most important like factor, but like if I say statistically, like after 35 years, especially after 40 years, patient needs more donor eggs. But sometimes, like if patient has early menopause, early deficiency, like premature ovarian like in failure, like in 20 years also she can need it, but mostly after 35, 40 years.
Good. Can patients receive information or view photos of egg donors in Azerbaijan?
In our, like we have like very strict rules like in donor procedure, like in our department, in our hospital. So surely we give all information about donor, but like not personal information and also not pictures. Like we give information about blood group, because we are trying to get to find donor persons similar with blood groups. And also we give any information like profession, how many child she has, what is skin color, eye color, height, weight, everything, but not like name and surname or address or picture. Like this part we cannot share, but another part we share.
Okay. So if patients cannot provide all their medical records before traveling to Azerbaijan Liv Bona Dea hospital, can these tests be done at hospital without extra costs?
If like preferable to send us like this, like 3 tests that, as I said before, like
This is must.
MAH and sperm test, because if we don't have this test, maybe she will need extra services to routine IVF, and we cannot inform it before, so it will be a little bit surprise for her. But if she cannot do this test in her country, surely we can do it in our hospital. Like consultation, ultrasound surely will be like free, but MAH and sperm test, I think it will be like extra.
Okay.
It doesn't cost like too much in our country, so it's available.
Good. So can patients have twins or triplets through IVF at the Liv Bona Dea hospital, and how do you manage multiple pregnancies safely?
Yeah, in IVF, like if we give like more than one embryo in the capital womb, we can increase the chance for twin or triple pregnancy. That's why before transfer we consult with like patient do you want twin or triple? If the patient says that no, I don't, I never don't like I don't want to have like twin. Surely we cannot get risk, and we give just one embryo. But like to give two embryos or three embryos, it doesn't mean that like 100% she will have twin or triple. Like with two or three embryos, she may have like single pregnancy too. But when we give more embryos, she has more chance for twin and triple. So we can do it, but she should be aware that it's not 100%. And when we have like twin multiple pregnancy, surely like the first stage, if even the patient leave Azerbaijan and go back to her country, like we continue our communication. So I have lots of patients, and we were in communication like some of them until the delivery, some of them especially like first 3 months is very important. And sometimes in multiple pregnancy we advise to like stop heartbeat one of them, sometimes no, like where we continue our recommendation to her. So if she wants to stay here, surely we can do our examinations here, but if she lives there, if she goes back to her country, like we can give some recommendation to her.
Great. So do international patients need to provide a marriage certificate to undergo IVF in Azerbaijan?
Actually, like for foreign patients or for our Azerbaijani patients, it doesn't change. Like if husband, like male or female, each one of them, woman or man, are married, they should show our marriage certificate. But if she says that, if they say that we don't marry, they should give our proof that they are not married. So like. The main thing is that none of them should not be married with another third person. If there's not this problem, so we can do IVF.
Okay. So why should international patients choose Liv Bona Dea Hospital for IVF treatment in Azerbaijan? As we know that there are many choices in many countries they do IVF.
Sorry, you're asking about the amount?
No, I'm asking that why international patients should choose only Liv Bona Dea Hospital for IVF.
Yeah. Okay. Yeah, like at the beginning, I gave like a little bit of information about that. Like when you choose hospital and your doctor, like they have like there are some points. Like first one, you cannot choose just doctor because it's like teamwork. Even the doctor is good, but the conditions of the hospital are low, or the conditions in the lab, or the working of embryologists is bad, or medicines are not good, the medicines are not storage in good conditions, you cannot get success, right? Success at the end. So when you choose Liv Bona Dea, because like it's like one of the most qualified hospital in Azerbaijan, and not only in IVF center, in other departments, success are also like good, because sometimes we need consultation with other doctors too. And cleanliness, sterilization in operation room, they are like perfect. Like our hospital like got like GSA certificate, and is the only hospital that has this certificate in Azerbaijan. And also like success rate of our department is over than average, and our embryology lab is very qualified, and embryologists. So like like our all, not only me, other like gynecologists are very qualified. So the patient should give attention all of these parts, not just doctor, all of them. At the end, like actual success rate totally shows like the quality of all of them.
Good. Thank you, Sevinc Doctor, sharing your expertise and answering all these important questions about IVF. Personally, I am impressed by your professional approach. To everyone watching, you still have chance to rewatch this video in Instagram, in our YouTube channel, or to listen as podcast. And if you still have any questions, feel free to leave comment or just message us on WhatsApp. And we are here supporting you on your health journey. If you want anything to add, Dr. Sevinc, please.
Actually, I just want to add another
Yeah.
one. Like it's very important for foreign patients about like difference in language. So, like why Liv Bona Dea asked, like it's one of the reasons is that like we have like some doctors, me and like other some doctors and also embryologists and also some nurses can like fluently speak like English, like German, Turkish, Russian, and also we have translator service. So our translators also can help. So our foreign patients never had this like any problem about the language here. So I think that like for patients it's very very important
Exactly.
to be understandable. Okay, and so
And this is
if
not to
like
extra cost. This is included to the package, translation services
yeah
also.
surely got it. So the patient, if the patient like around like medical staff cannot understand the patient, she will not feel like comfortable. And
Yes.
also our all in like forms that inform the patient about these procedures we have in other languages too, like not in Azerbaijani. So I think that is one of the most reasons why Liv Bona Dea.
Understood. Thank you again for answering all these questions. And thank you for all joining us to this Instagram live session. Take care, and we will see you in the next live session. Bye, Dr.
Thank
Sevinc.
you. Bye bye.
Bye.